two are currently under suspicion. We're prepared to handle this. We are prepared to handle this. We have a plan in place. These inmates were and are all in one pod. They're being medically cared for. None are critical, and they are quarantined in place.
Good morning. We're here for our Friday briefing, our usual Friday briefing, and per our customary approach, I'd like to first give the floor to County Executive Armin Budish. County Executive.
Morning, everybody. I had prepared to talk about an exciting new project that we were ready to introduce, but I'm going to hold that for our next conversation because I want to address the subject I'm sure you're most interested in. So, we've had 6 jail inmates that have tested positive for COVID-19, and 2 are currently under suspicion. We're prepared to handle this. We are prepared to handle this. We have a plan in place. These inmates were and are all in one pod. They're being medically cared for. None are critical, and they are quarantined in place. Tracing of these inmates and the staff that were potentially exposed is going on. The city and county health departments are working together to support Metro in this investigation. And it's important, I want to repeat, we are prepared for this. With the help of the sheriff, the courts, and the prosecutors, we've been steadily reducing the jail population. Efforts have been Herculean. We've reduced the population by almost 50% to 1,050. That was done to reduce the risks and to create space for potential isolation and quarantine. We've been screening every inmate and every officer who comes into the jail. No personal visitation has been allowed. It's important to note that these 6 inmates have been in the jail, some of them since July of 2019. The most recent admission to the jail was February of 2020. So there's no way these 6 inmates brought this COVID-19 into the jail. Our jail COVID medical plan has been in place since March 10th. We've been following the state and national guidance to prepare our plan. There have been 7 COVID tabletops performed by the jail and Metro since March 10th. The jail staff has had appropriate PPE, protective equipment. We at the county have been ordering as much PPE as we can lay our hands on. We continue to do that. No one ever has enough. Just yesterday, prior to all this happening, we delivered from the PPE that we had purchased. We delivered 30,000 more gloves to the jail and 10,000 more surgical masks. COVID-19 is everywhere. It's everywhere. It's impossible to totally escape this terrible disease. But we have an excellent team in place, some of whom are here with me today. They've worked tirelessly to prepare for just this possibility. We've taken immediate action today around the planning that's been in place, and I will again emphasize, we are ready. With that, I'll turn it over to Dr. Bruner for a moment to speak.
Good morning, everyone. I'm Dr. Julia Bruner from Metro Health, Physician Executive for Ambulatory Operations and Medical Director for the jail. Last night, early evening, it came to our attention that there were several people that were reporting being symptomatic. They all live in the same space. Our team immediately implemented placing surgical masks on those individuals and getting them into an isolation space where we could initiate evaluations and testing. During that time period, the medical team was wearing the appropriate PPE in relation to these evaluations, and in the middle of the night, we had tests come back as positive for this group. These processes were followed as we had planned, as we'd worked out in relation to what Mr. Budish was discussing around the tabletop exercises. The tabletop exercises that we've been doing over the past month are really related to planning and implementing things to prevent further exposure or even prevent potential infections coming through the jail overall. So we've been spending quite a bit of time on doing various scenario testing amongst ourselves to prepare for this. We're going to continue providing the care that we should. We're going to use the right PPE. We're going to take care of people as we always do. And as things change, we will adapt to it as well. So, you know, I think the one thing that Mr. Budish pointed out that I would like to repeat is we knew this was going to happen because it's a community-related issue. It's a worldwide issue. And so we were planning and moving forward, and the efforts that took place through March in relation to reducing the volume of people in the jail have allowed us to actually implement many of our plans and to reduce the risk of transmission across this space. So thank you to the judges, the prosecutor's office, the sheriff's department, and jail administration and Metro Health as a whole really working together to make that happen. That's all I have.
So since the beginning of this investigation, and certainly for many years prior, we've been working very closely with Metro Health and with our partners in the county administration. And I think those partnerships are critical now because, as Dr. Bruner described, we know that COVID-19 is everywhere. So it is our intent to work very closely with our partners at the Cleveland Department of Public Health and with Metro Health and the county administration as planned in the policies and procedures that have already been outlined around contact tracing and identifying those that may have been exposed. There already has been a Head Start conversations very early this morning to begin that process. And so we're following the playbook that we have put in place from the beginning of this process. And we intend to follow that with our partners in collaboration. And with that, I think we should open it up for a few questions that people may have about where we stand. But I would remind you, this is a fluid situation. This is brand new. And we need to allow time for the process, for the work to begin to identify the close contacts and some of the details of this investigation, so it's ongoing. So with that, we'll pause for questions.
You mentioned about PPEs, 30,000 gloves, 10,000 surgical gowns. Is that enough? And are you guys reaching out to the state or federal departments for more?
We're constantly reaching out for more. We're reaching out to the state, we're reaching out to the federal government, we're reaching out to vendors across the country, in fact, around the world. We've been doing that for months, weeks, and we've been very successful. We've spent around $1 million so far on PPE as a county government. We've asked for, and we continue to ask for, donations of PPE. We've received many donations of PPE, masks and gloves and other things, largely from dentists, veterinarians, retired physicians, others that have it still around that they don't need right now. I think we've done very well with PPE, given the circumstances that everybody's short around the world. We need more. We'll continue to purchase. I've authorized our team basically to buy what they need.
What's the jail population as of this morning, and how confident are you guys that you have this isolated to one particular group within the jail? Obviously, there's a lot of movement as people's status changes and things. How far back, have these people kind of been in the same unit, or have they been across a number of units in the last few days, weeks?
So we're, the county, the jail is actually working through that process this morning so that we can do tracers in relation to where people have been over the last several days. It's my as Mr. Budish stated, they've all been within the facility at least since the middle of February. So we'll have to work with the jail to figure out if there was any movement prior to this, and that's how we'll do the tracers with the Department of Health in relation to tracking.
What's the jail population at this point?
It's a little bit over 1,000. That wasn't a number that I tried to remember this morning.
1,021 downtown to be exact.
Thank you, Sheriff.
And I'm sure contact tracing work is going to go on to see how many COs came into close contact with these inmates. I'm wondering if any COs have been, told to quarantine or isolate as a result of this new information and these inmates.
So from a contact perspective, what we're using is the guidelines set up by the state of Ohio and Metro Health in relation to deciding what exposure and what contact truly means. And that contact means direct contact with an individual who's known to be infected for at least a minimum of 10 minutes within a 6 feet distance, or they're exposed to respiratory droplets. So we don't have estimates yet, but we are working through that with the Department of Health. Okay, there'll be more on that later.
And I just want to add, I want to commend our corrections officers and our entire staff at the jail, the Metro Health nurses and others that are there. These people have been putting their health on the line to make sure that the prisoners are protected, to make sure that the community's protected. This is critically important, and it's dangerous work. And we want to, again, thank those who are doing this. Just like the nurses and the doctors in the hospitals are putting themselves at risk in order to care for our community, so too are the people in the jail.
Yeah. Were these 6 inmates together in one specific area, or were they scattered throughout?
The question is, were the inmates in one specific area, or were they scattered throughout?
They were in one specific housing space.
So is
So-
there any risk that they may have come in contact with other inmates in different areas?
So that's part of the work that's going to be done today, to figure those things out. One of the things that was done overnight is that housing space. We implemented a process for those that were not symptomatic, that they remained in that space and didn't move anywhere else throughout the jail.
What would you say to the public if I have a loved one who may be currently in jail and I'm just now seeing this news?
I think the public should know that Metro Health and the county overall, have been working on, since March 10th, there have been plans put in place based on federal and state guidance. That those plans, as you've heard, have been practiced, tabletop exercises, multiple tabletop exercises. And that the plans put in place, because of the fact that COVID-19 is everywhere, because of the fact that we know it's throughout the community, that those plans now are being used and followed to try to begin the process now of identifying close contacts with a team, with an extensive team of people from Metro Health, from county administration, and from the health departments to work through the process. And we want folks to understand that we've been doing this now for well over a month in other settings where people are in grouped together. And so we're going to follow the same process that identifies those close contacts. We're going to follow the process that we know is set forth by the CDC and the State Health Department, and that we are in the very early stages of this process. We ask that you allow us to work through this, and that there have been steps taken as recent as last night and very early this morning to begin to identify the scope of this investigation, and that it is fluid, so it will evolve. And we ask that you allow that process to take place, and we'll know more as we go forward. So that's what I would say for the public, and say that we're a team. We've been a team for a long time, and so that's the way we're going to approach this process.
Are you guys releasing which housing units affected?
Good morning. No, we're not releasing that at this time. You know, it involves the security nature with the jail. So, yeah, we're not gonna release that at this time.
You have 2 other inmates that are suspected cases.
Yes, that's correct.
Any CO that you're aware of?
I don't know about any of the corrections officers as of yet. You know, we've taken precautions with them. Some of them have been identified that may have had contact with the individuals that we're talking about. So we're dealing with that aspect of it as well.
We'll do one more question.
Has this caused any other delays in the court systems? I know there was the central court, but has that been delayed or postponed?
The question is, has this caused any delays in the central court system? Any delays or postponements is the question.
The only thing that we did this morning as a precautionary measure, I spoke with Judge Sheehan, the presiding judge of the Common Pleas Court. There were arraignments scheduled, which have been done largely through the video process that I know some of the cameramen here are familiar with up in the arraignment room every day. So those have been postponed for today, as well as in the Cleveland Municipal Court, so as to not have to move a lot of inmates around the county jail right now. We're hoping that that's just going to be for a brief period till we evaluate everybody. In my conversation with Judge Sheehan this morning, we are going to be holding Saturday arraignments, so we're hoping to get that back up and running tomorrow morning.
Okay. Thank you all very much. We're going to take a 5-minute break as we transition to the next portion of our update this morning. So we ask for your patience. Thank you. So I wanted to say a word about Manor Care. Dr. Gullett and I want to recognize the staff and administration at Manor Care for all of their work. We've been working hand in glove with Manor Care since the beginning of the investigation at their facility. They've been very cooperative with us. I think, have an ongoing relationship with them, and we feel that they're taking all the necessary steps they can in a situation where you have a facility with a lot of at-risk individuals. The guidance on long-term care facilities is clear. Fragile individuals in facilities like long-term care facilities or skilled nursing facilities are particularly at risk. And we feel that Manor Care has taken all the necessary steps and the appropriate steps in this response. And we wanted to acknowledge that and to publicly say that we will continue to support them in the work that they're doing. And we know that they're being responsive and certainly very considerate of the patients and the families in this process, and we appreciate that. So we do know that congregate settings, and there's guidance certainly around places where people come together in large groups, are particularly at risk. And so we've seen situations related to university campuses. We've seen situations in clinical environment, or we've seen situations even on some of the issues that we've seen on cruise ships and the like. Congregate settings put people at risk because they're in close proximity. And some of those situations are unavoidable. And so we follow the guidance, and we know that the guidance put forth by the CDC and other authorities is the playbook for which public health will continue to approach these investigations. So we need to know, everyone needs to know, that COVID-19 is everywhere. We've given that guidance to our first responders, that on every call that they make, and every response that they make, that they need to be approaching the situation as if any individual that they transport is COVID-19 positive. And that's the way that we need to move forward in the community. Social distancing is critical. Following the governor's guidance around mass gatherings, the stay-at-home order, all these issues are critical. Cleaning surfaces, proper hand washing, covering your sneezes appropriately and your coughs. All these things come together. Not one single thing, but a collection of things are necessary. And we have to follow the course that's been set forth. We know that the governor extended the stay-at-home order to May 1st. And so that was effective next Monday night, April 6th. So we're going to continue to follow this process, and we still have a ways to go, folks. We're still climbing that curve. We believe we're having an important impact on the work we're doing together with clinical medicine, with public health. So we're going to continue to follow that playbook. And I think Ohio is well positioned because of the leadership of Governor DeWine and Dr. Acton, in concert with 113 health departments that are working across the state of Ohio in its 88 counties. So the governor has developed a dispute resolution panel. As you know, we've handled thousands of calls relative to the essential service designation that Governor DeWine put forth. And the whole idea here is to reduce the number of folks that are congregating together. We want businesses to support remote work where possible. We want businesses to consider postponing activities and their work for some time if they're able to, if they're deemed non-essential. Given that these rules are new and the guidance is new, there may be some variation on interpretation of individual counties as to whether a business is considered essential or not. And so the governor has established a dispute resolution panel for business operations to work through situations where there may be a difference of opinion or questions about whether a business is essential. And we think that this is a good step. It will help to create some clarity in this very fluid guidance. So those are my updates this morning. And we have a very rich data update for you that Dr. Gullett will now provide. And so I'll transition to Dr. Gullett.
Okay, good morning. Thank you again to our media partners here with us in person, as well as our county media team who's been really helping facilitate this and assuring social distancing. thank you as well to Heather. We're really grateful for her help this morning, especially in an extended briefing where we're able to provide information from multiple people. She's adapts quickly to lots of different people speaking, so we thank you for your continued support. This morning, for gratitude, I would like to really recognize our colleagues at Manor Care, as well as other long-term care facilities, skilled facilities, and employers that have been working with us on cluster investigations. You have heard me talk about cluster investigations for a couple weeks now, and I want you to know how much work and how much time goes into each of those teams at each of those respective organizations, really pouring truly their heart and souls into protecting the people they serve, whether they're patients or whether they're community members, as well as their own staff. And that just is something I want the public to understand, that they at Manor Care and many other organizations have been nothing but the truest of partners in this. You know, the hashtag in this together Ohio is really, really important right now, and we really are partners. So I just want to thank all of you. You know who you are, and we're so grateful for that. I would also like to thank our hospital partners again, because over the last few days we've had further discussions. As we all know, testing has been very difficult for us on the community side, and truly in the hospital setting. Testing has been much lower than all of us in public health would want in order to control this and flatten the curve as quickly as possible. That's no one particular person or group's fault, but the reality is that we work with the resources we have, and our hospital partners are really trying to work with us to figure out how we can safely and effectively use the resources that, even though they're limited, to test in ways that really magnify our ability to do a public health field response that reduces transmission and flattens the curve. So what that means is we're trying to be innovative and creative about using the testing we have to really make the biggest impact. And we're hopeful that we will continue to see more testing available, but right now that's not available for us so much on the local level. And so I just thank those people who are trying to think creatively about giving us additional resources. And in this case, in Cuyahoga County, that's our hospital partners, as well as the Ohio Department of Health. So I thank you all for that. I'm going to pause for a moment and allow the cameras to move to our slides and allow Heather also to move over. So you will hear silence for a few minutes, and then we'll begin again when everyone is positioned. Okay, it looks like all of our cameras are positioned, and it looks like Heather is ready to go. So Kevin, I'll take the first slide. So for the CCBH jurisdiction, our current case count for lab-confirmed cases is 513. The age range for those cases is 11 months to 101 years old. The date of illness onset is February 29th to March 31st. And we have 10 deaths to date. And again, I would like to remind everyone that I don't give these data as simply numbers, but these are 10 families in our community who are grieving, who've lost a loved one, and with whom we stand with our deepest sympathies. The age range for those dates is, for those deaths, is 63 to 91 years of age. Deaths have occurred related to COVID-19 in our jurisdiction between the dates of March 20th and April 1st. And those include 6 females and 4 males. I'm also giving extended information on Fridays about our continued case identification and contact tracing work. This is specific to our jurisdiction. To date, we've sent out 598 isolation orders. We've sent out 831 quarantine orders, and we have cleared 60 people as of last evening from COVID-19, which means that based on the Centers for Disease Control and Prevention criteria, we have declared them recovered from the infection and no longer in need of staying in isolation. However, we still have the stay-at-home order that applies to them. So this isn't that people are going to begin to go about their daily life as they were before the stay-at-home order. This simply means that we're declaring that they have recovered from the infection. These continue to change on the hour, so the numbers I give you every Friday are reflective of the prior week's work, but you'll see that these are going to continue to rise based on the number of cases we have. You may also add up the numbers and wonder why they don't exactly add up to the numbers that I gave you on the number of lab-confirmed cases. But remember, I've spoken previously about what we call presumptive cases, which are people for whom we don't have the ability to test, that they have a link to a lab-confirmed case. They are a contact of a lab-confirmed case. They themselves became symptomatic, but they're mild enough to be at home. They haven't needed to go to the hospital. So we isolate them in place in their home, and we treat them as if they are a lab-confirmed case. But we don't report those in the lab-confirmed numbers because they haven't had a lab test. In a perfect situation, we would be able to deploy testing to every single one of those individuals, but we are not able to do that at this time. So you'll see there are more isolation orders than the number of lab-confirmed cases, and I wanted to again explain why that's the case. We feel like this is a very important approach to flatten the curve, because if we don't have the ability to test everyone, but we really suspect they have the infection, isolating them is really critical so they don't pass the infection on, and that they themselves have what they need to recover from the infection in place. This is simply here as a reference. You have seen this many times. There are many versions of this. I will continue to leave it in our slides, which will be posted each Friday after the press conference. This just gives you an idea of how our epi curve at the local level relates to the overall understanding of flattening the curve. These are epidemiologic terms that we don't traditionally talk about in the media or in lay press because we aren't usually having a pandemic, but we want everyone to understand what we're doing here and understand how to interpret the data and actually get to the bottom line for what it means for our community. So I'm going to continue to include this as reference. This is the Cuyahoga County epi curve for this week. We do have to have a cutoff for when we interpret our data. Analytics on epi curves and mapping takes a little bit more time than the tabulation of frequency data that you see me presenting in the slides. So these maps and this epi curve will always be a few days behind the actual numbers that I'm presenting, just to clarify why you may see a few different numbers. Also, I want to again remind everyone that this map, or the map coming up in this epi curve, are reflective of the entire county, Cuyahoga County, which includes the City of Cleveland Health Department work as well as the Cuyahoga County Board of Health work. We work very closely with our Cleveland Department of Health colleagues, and we are all contributing to the same approach. So when you see this epi curve and you see this map, please understand that that's the work of both of our local health departments. On this epi curve, you'll see that we've continued to report in blue the date of symptom onset. We do have some missing data, and you'll see where we've noted cases around missing data. We're working very hard to pin down the exact date of symptom onset, but in some cases, people are on a ventilator or their family informants are not able to give us exact information. So we're working our very best to get as much as we can, and we'll continue to update that information. Those are items of information that we report to the state and the CDC. So our disease investigation sometimes takes us a little bit of time to get that. But you can see a pretty nice curve on the date of symptom onset for the vast majority of our combined cases across both health departments. You'll also see the red continues to go up, and you see we are not on the other side of our curve. Okay, these numbers continue to go up, and they will continue to go up until this peaks. And again, you're hearing Dr. Acton and others talk about modeling. about when that predicted peak will play in here locally and at the state level. But there are a lot of different assumptions about those models. And so what I want to remind the public is that we're not going to get on the other side of this curve unless you stay home and you socially distance when you're not at home. And you also do the other things we're asking, which is making sure you're cleaning spaces, making sure you're washing hands. Those are the things that are going to help us get on the other side of this curve, but this curve is going to continue to go up. You'll see in red, the specimens here are when we increase testing capacity locally. But again, as I've continued to remind you, and again this morning, we don't have significant testing across the community right now. So this likely represents an underestimation or a lower amount of actual infections than are truly in our community. So please understand when you interpret this, this is only reflecting the testing availability we have, which is mostly for hospital patients and those who are in the healthcare workforce. You will also see in green that we've begun to also put on our curve recovered cases. When we clear someone from a case, we do what's called a discontinuation of isolation. It's really just a public health speak for we're telling you you're recovered from this infection. But we really wanted to share this information with the public so that you can see what prevention looks like. You can see the results of case identification and contact tracing. And the more we see this increase in cleared cases, the closer we'll be to being on the other side of this epi curve. So we will continue to share with you these cleared cases and the date of clearance every Friday. This is our map for this week. This again is a map by zip code. And so we will continue to update this each week, and you'll be able to see as this progresses over the weeks. You'll see that we have cases across the entire county. There is really nowhere in the county that's unaffected. And you'll see that as the weeks move on, the green will darken. We will see higher frequencies of cases as time moves on. And so our goal is to get ahead of the transmission so that the entire map doesn't end up dark green, but we do know that the green will continue to darken over the coming weeks. And we will continue to provide you this information insofar as it helps you to understand the distribution of cases. Please remember that these cases are always reported in their home address. So somebody may be seeking care here in Cuyahoga County in one of our tertiary or quaternary hospital care centers, but they may not be reflected in this. And when you see the hospital information around utilization I present next, just know that a lot of people being treated for this in our hospitals actually live in other local health department jurisdictions around Northeast Ohio. So these simply reflect the address zip codes of the people who've been diagnosed where they actually live, but it doesn't necessarily mean that that's where they currently are, especially if they're in the hospital. And then my final slide just explains a little bit more about some other data points which we are using to help us better understand the situation locally. I presented a percent positive aggregate estimate last week, and just to boil that down and not use so much jargon, basically that's understanding the percent of COVID-19 tests that are being done and how many of those are actually positive. It's a little hard for us to present that because the testing is being done at so many different places, and so we're having to really pull together a lot of disparate or different data sources in order to understand the true percent positive for our community. So we have tests that are being run in private labs, we have tests that are being run at the Ohio Department of Health on a very limited basis, we have tests that are being run at different hospital systems. And so in order to give you an accurate percent positive, we've had to aggregate those data, and that's a little bit challenging for a number of reasons. But we do thank our partners for providing us as much data as they could on a weekly basis so we can help our community understand the percent positive. So last week I reported the percent positive at 5%, but you also recognize in our other briefings I've talked about testing being stratified or tiered for those at highest risk for being sick, so those in the hospital. So our testing is really focused on those in the hospital and focused on healthcare workers who become symptomatic and first responders who become symptomatic. So it isn't a surprise that our general estimate of the percent positive is higher this week, because we're testing people who we suspect have the infection because they're very sick in the hospital, or they're people who we know have been exposed who work in hospitals or in first responder settings. So I just wanted people to understand how to interpret that when they look back to last week's data. This again is information at the county level and includes the city of Cleveland data as well. So the percent hospitalizations of all COVID-19 cases in Cuyahoga County, 32% of those cases have been admitted at one point in the course of their illness. That doesn't mean that they're all still admitted, but it does mean that they've been admitted at some point for hospital care. The total cases in Cuyahoga County, of all those cases, 10% of those cases have required intensive care unit or ICU care at some point in the course of their illness. 33% of the cases in our county reflect healthcare workers, broadly defined, so anyone who works in a healthcare setting in any job type or first responder setting, like our firefighters and our paramedics. And then finally, percent utilization. This is not specific to any one system. What we are most interested in is the overall capacity to provide hospital care when necessary and appropriate across our county. So what you see reflected here is that we are currently at 62% of utilization or capacity for medical and surgical beds for adults. For pediatric, we're only at 31%, and these are pretty similar to last week. We actually know that we aren't keeping people in the hospital who aren't needing to be there. We always want to keep people at home if at all possible. So we have pretty similar numbers. Actually, the pediatric, we have lower utilization of pediatric medical beds this week than last week. For critical care, we're very similar to last week. We're at 69% of utilization, meaning for our ICU beds, we have 69% of what's available is currently being used. And last week I reported we were at 65% for the county. And then with regard to ventilators, we are at 55% of utilization of the ventilators we have available across the community. And last week we were at 36%. And I would like to also just clarify that the percent utilization may continue to evolve as hospitals and our state work on surge capacity, meaning as they continue to increase the number of beds available through different pathways that people asked about at this press conference Wednesday and has been discussed by Dr. Acton and Governor DeWine, you'll see that these numbers may change because this is based on the availability of beds today. And if there are increased beds open up, you might see the numbers change a little bit because now we have more beds, so we may have utilization go down. And the goal is that we never get to 100% utilization where we don't have enough beds for the sickest people and we don't have enough ventilators for the sickest people. That's why flattening the curve is so critical. And that's why we're going to continue as a public health department to work tirelessly and in a very determined way on the community side to reduce transmission and flatten the curve as quickly as we can to reduce a risk of coming up against resource challenges on the hospital side. With that,
her training as an academic physician is apparent as she describes these slides. I think she's certainly a blessing to our department and to this community, and I think I'm eternally grateful for everything she does to work with us as the medical director and to really embrace her role as a community doctor here in Cuyahoga County. I have a couple folks I want to thank this morning, a few. So first, Drs. Stackland, Dr. Rose, and Dr. Tarabu, who are involved with putting together these data. They are up often in the wee hours of the morning to assure that the most up-to-date data is accurate and available for you to inform the community of where we stand during these once-a-week updates, and so I want to thank them. I also had the good fortune to be on a call yesterday with the philanthropic community, our local foundations in the region. As you know, they've reported publicly that over $5.3 million has already been made available to the community to assist with a range of social services that are critical for those that need it most. And what our foundations have done time and again in Greater Cleveland is they are there for people who are often invisible, people who are ignored, who may not have access to resources. They may need groceries because they're in quarantine. They may need assistance with medication. It may be support for the food bank through their drive-through, feeding countless families that may have nowhere else to go. And there's a range of other supports, services that the foundations are considering and embracing our community as they have. And I think we are very fortunate for their generosity and their commitment to support Greater Cleveland through this COVID response. So with that, I'd like to open up the floor for a few questions.
How has the governor's designation of the 3 zones impacted us here locally and the hospitals locally?
So the question from Lisa is, how has the governor's designation of the zones, the hospital zones that have been established, affected us locally? So I think that the best way to describe that is that our hospital systems throughout the state of Ohio have large reaches. Many have multi-county reaches. We know that we have Metro Health and University Hospitals and the Cleveland Clinic, Southwest, St. Vincent's. A range of those systems have reaches that extend well beyond the Cuyahoga County borders. And so we recognize that thinking about it in regions about care is not dissimilar to what's happening here in Greater Cleveland around the Northern Ohio Trauma System, or NOTS process, where they actually look at trauma care. I was part of the board for the NOTS board for 6 years, and in that process, they looked at trauma as it may occur in the region relative to acuity, making determinations to assure that only one helicopter would respond or one squad respond to a trauma event. And in the process, I think the model from NOTS, or the Northern Ohio Trauma System, is being used on a statewide basis as a way to assure that care is provided at the right place at the right time and by the right folks to deliver it. And so that model now, I think, has been extended statewide, and I think it's a welcome development. That way we can assure, as Dr. Gullett described, how bed capacity is utilized in the right places, looking at surge and differences in utilization across the state. We can think about how forward movement of patients to places that may have beds, to areas where they can be served. And so it allows for coordination and real-time adjustment for the clinical community. And certainly they can expound on some of those details to a much greater degree. But I think it's a welcome development, and it also shows that there's foresight going forward as we continue to climb the curve in this extended response.
With the available capacity that you guys have now in hospitals, both particularly with ventilators, ICU beds, and adult care, are you where you would hope to be at this point in the curve?
So the question is, given our current availability of beds, medical, critical care, ventilators, as well as the workforce, because the utilization isn't just about the physical pieces. It's not just about having beds. It's not just about having ventilators, but it's about having people trained to run them and provide the level of care needed for each of these folks. So the question is about, are we where we would want to be with those resources where we are on the curve? And I wish I could give you a clear answer to that, but I think it's not an easy question to answer. We are very fortunate in this community to have a considerable amount of resources from a medical standpoint for high-level care. If you're sick anywhere, there's probably not a better place to be than in Cleveland, with the number of hospitals, the number of highly trained medical professionals and teams, and the number of physical units of ventilators and beds. So what I can say is that I'm watching this closely as I see our numbers climb, but I'm also trying to work really hard with our team here to understand where we are on that curve to be able to answer Scott's question for the community on a nearly daily basis. I think time will tell. We are looking at lots of different models, but all of those models are based on assumptions, and so models can be only as helpful as the assumptions are, and as accurate as the assumptions are. So we will see. We will see over the next few weeks. I do feel great about the partnership with our